Hello everyone. I welcome you all to the new episode of Meet the Knee Expert. We have with us Dr. Parag Sancheti. Thank you so much for joining us today, sir. Like always, we're going to have some interesting conversation with Dr. Parag on the varied issues related to healthcare. So today I wanted to pick your brain on a very interesting topic, because when we asked all our viewers and people visiting the hospital about what is one question that you would like to ask Dr. Parag, a lot of teenagers came back to us saying, is there a way to increase our height? So people who were facing that dilemma about, am I tall enough or not? And this seemed to be a very recurrent question. So have you ever been asked this question?
Ask me about it, Dr. Saurabh. I get asked this question all the time. And since I'm an orthopedic surgeon dealing with bones, everybody feels that the height can be increased by an orthopedic surgeon. Then for every OPD, I have at least 2 or 3 patients, in the age group between 12 to 20, 22, or sometimes even more, asking me this question: can my height be increased? Always, all the time.
Right. So before I ask you that, what is your answer to them? I would like you to explain our viewers, what is the science behind growth? What is the science behind increasing height? How does it work?
Yeah. So first of all, let me tell you the science first, and then we will talk about whether it can be increased, it cannot be increased. Let's just hold on to that question for a minute. So the science behind the growth of an individual, especially the height-wise, is related definitely to something called as a growth plate, which occurs in the long bones, especially the humerus, radius ulna, the femur, and the tibia. So there is something called a growth plate. It is a part of the bone which remains open and through which the height can increase. And this growth plate of an individual remains open generally up to the age of 15, 16. And sometimes in some individuals, even later it closes. It can be up to 17, 18. So to answer your question, the height of a person can increase only till the growth plate is open, and through that it can increase. But once it closes, which is on an average 16 to 18 years of age, after that technically there can be no growth, except sometimes at the age of 19, 20 there is a second growth spurt. At times there can be some increase in height there, but the majority of the height, 90% of the height, is up to the age of 16, 17 years, till when the growth plate in the long bones is open.
Excellent. Is there a way to know till what age the growth can happen, or is there a possibility for me to grow even more? So is there a way to know that?
Oh yes. So as I just said, the height of an individual can grow up to the age of 16, 17 years until the epiphysis or the growth plate is open. Well, we can find out by taking x-rays whether the growth plate of that individual is still open. And the last growth plate to close in the body is the one in the elbow. So if we take the elbow x-ray and find that the growth plate, especially at the tip of the elbow, is open, that means the growth potential of that particular individual still exists and he or she can grow even taller. But you take an x-ray and you see that the growth plate of the elbow is closed, then the height of that individual cannot increase anymore. As I said, maybe a little more at the age of 19, 20, but nothing beyond that.
All right. I'm pretty sure demand for elbow x-rays is suddenly going to increase after this.
I think so.
But so there are a lot of, if I do a Google search about how to grow my height, so there are 2-3 most commonly suggested things. So I just wanted to understand, is there any fact behind that? So number one is always some exercises, like hanging on a bar or doing some stretches. So what is the truth behind that? Can specific exercises assist in growth?
So first, let me tell you an important fact of life, that height of an individual is genetic. When I say genetic, it is dependent on the genes which they get from their parents. So if the parents are tall, generally you see the mother and the father is tall, more often than not, the child will be tall. And we see that all the time. So definitely genetic is an important factor which decides the growth of that particular individual, and majorly controlled by the genes of their parents and what they get into them. That being said, you just talked whether hanging or diet or taking any particular medicines, is it useful? So hanging on the bar, many times people ask me, if I do pull-ups, if I hang on the bar, will my height increase? Well, if your growth plate is increased and you do that, it's always a good idea to do it. But will it increase? Like if you take two individuals, one who does every day, push-ups, pull-ups, hanging on the bar, and the person who doesn't do it, it doesn't necessarily mean that the person who does it, his height is going to increase. So there is some merit to the extent that it's a good form of exercise. It keeps you healthy, but it's not sacrosanct that if you do pull-ups or if you hang on a bar, your height is going to increase.
The second thing, like you mentioned in the passing about nutrition. So
Yes.
they say that a lot of nutrients can assist or at least help in growing and all of that. So do supplementation, multivitamins, do these things help?
Yeah. So, talking about medicine, then I get asked this question so many times. Patients come to me or individuals who are short come to me and say, "Doctor, give me some pills, that will increase my height. Give me some tablets." Well, friends, there is no magic pill. You don't get that. If that was there, I wouldn't be here. I would be probably a multi-billionaire sitting somewhere on an island and enjoying my life. So there is no magic pill. There is no way you can give some tablets and assure an increase in height of that individual. But that being said, taking multivitamins, which are important in the growing age, taking proper nutrients like the micronutrients or the essential minerals, that's very important. So in the diet, if you can get all of these multivitamins or micronutrients or the minerals, then it's good, because that definitely helps to stimulate the growth. It has been shown that if you are certain diseases like lack of vitamin C, scurvy, or vitamin D deficiency can stunt the growth. So therefore it is important to take this. But even if you're growing normally and you take excess of vitamin D or vitamin C, that's not really going to help you to grow. But it is essential that you ensure you get the multivitamins, you get the good nutrients and also the minerals in your diet, or if not in your diet, then through some supplements.
So, you told us about medication and supplementation. What about normal diet? Like, are there any specific things, like you said, if there is a deficiency, your growth can be stunted? So what guidance would you give our viewers to include in the diet so that none of these deficiencies occur?
Excellent question again, Dr. Saurabh. People come to me and ask me, I'm a vegetarian, but if I start eating non-vegetarian, or if I, have chicken soup or, all these things, is my height going to increase? Well, friends, the answer is no. So you don't have to change your diet, but at that same time, make sure you have a balanced diet. You have the right proportion of carbohydrates, proteins, and the fats in your diet. And as I just said, along with all the nutrients, vitamins, and minerals. So the diet, even if though you're eating vegetarian, make sure you have adequate proteins, because generally speaking, the veg diet does have a little less proteins as compared to people who eat non-veg, because it's more available in the non-vegetarian food. But that being said, there is enough veg food out there which can give you the basic proteins you require, or the carbs and the fats. So again, nothing to do with diet, but a balanced diet and a healthy diet is very important. Don't eat junk food or something which makes you unhealthy or makes you put on weight, because it has been shown that obesity actually stunts the growth. So definitely eat healthy, keep your weight in control, and don't be too fussed that if you're a vegetarian to convert yourself to a non-vegetarian.
Understood. So you being an orthopedic surgeon, now if we look at some extreme ways of increasing the height, does surgically height growth is possible?
Again, the question which I get asked all the time, the answer to that is yes. If somebody comes to me and says, "Doctor, can you increase my height by doing some operation?" The answer is yes. But would I do it? The answer is no. If a patient is not so tall, let's say 5 feet, 5 feet 2 inches, there is no way we can, advise or recommend the patient surgery, even though by cutting the bone, there is a Russian technique called as the Elizarov technique, where we do a corticotomy and then, distract the bone, and the height can actually increase. And the height can increase up to 6 centimeters, 7 centimeters, 10 centimeters, or even up to a foot. And there have been examples of people getting that done. But please, even though it can be done, it's a strict no. Your height is determined by your genes, it's genetic. Don't try to play with Mother Nature and ask your doctor to increase the heights, because there are complications associated with this. So to answer your question, surgically height can be increased, but I definitely don't recommend it to be done. Just as a follow-on to this, well, do we use this height increasing technique in some patients? Yes, we do. If it is a congenital defect and one leg is shorter than the other, then to correct the limb length equality, then we can increase the height of that particular short bone. Especially we see it in the tibia or the femur, where there are some congenital shortening in the hip or proximal focal deficiency or in polio or certain conditions where the leg is short. Or inherently, sometimes we see that, patients are just born with one side short. In them, we can do this Elisa Rao technique where we cut the bone and lengthen it and then make both the limbs equal. So in that, I will advise it and I will do it, but not in a normal patient just to increase the height.
To conclude, I would like you to give advice to our viewers. There are still people out there looking to ways to grow their height. So what would be your advice to them?
So friends, you can definitely control increasing your height to a certain extent, to the extent that please eat healthy, do regular exercises like pull-ups or hanging on the bar, push-ups may help. Please do that. Also have a very good healthy diet, a balanced diet which I just spoken about. And then don't worry too much about it. It's quite natural that if you are short, you may get some complex. And patients come to me, 4 feet 9 inches, 5 feet. Doctor, I am feeling so bad. I am the shortest in my class. What do I do? What do I don't do? And they feel quite depressed. So let me say, friends, please don't get depressed, because height is something which is God-given, God-gifted. You can't control it too much. So don't try to control it. And I can give you enough examples of people who have accomplished so much in their lives. Lal Bahadur Shastri, Napoleon, Sunil Gavaskar, Messi, Sachin Tendulkar. All these people are so short. And look where they are. They're world famous figures. And they've achieved so much and accomplished so much. So there is no need for any individual to feel disheartened or to feel depressed or let down that why am I so short? And if people like these can achieve so much, so can you. So friends, I just want to leave you with a note. Don't worry too much of your height. As long as you have good health, you're in perfect shape, you're doing all your routine activities, height has got nothing to do with good performance. Height is something which is genetically determined. Don't try to control it. Whatever it is, accept it. And surely it's not going to come in the way to accomplish your goals. You can achieve whatever you want in life with whatever height you have. That's surely a bold statement I want to make before I finish.
Thank you so much, sir. That will definitely open eyes and make a lot of people make peace with their height and be very happy with it. Thank you so much, sir.
Thank you, Dr. Saurabh, for inviting me to this program. It was so nice to talk to you on this very important topic, and I hope I have been able to add some value and contribute some knowledge to our viewers. Thank you.